Hello guys, in this lesson we'll talk about osteoarthritis in dogs and 5 ways of helping your dog with this limiting disease. So osteoarthritis is a progressive, degenerative and irreversible disease that worsens over time since the cartilage cannot repair itself. It is thought that 20% of all dogs, regardless of age, are affected by osteoarthritis, making it the most common chronic disease dogs can face. It is more commonly diagnosed in middle-aged wolves, large breed dogs, and basically with osteoarthritis, what happens is that the cartilage within a joint begins to break down, the underlying bone begins to change, and it causes inflammation. It often results from a genetic disease like hip dysplasia or elbow dysplasia, where joint surfaces don't fit well or where joints are unstable. As a result, cartilage gets damaged when joint surfaces don't fit well or when a bone repeatedly slides in and out of position. It can also result from accidents and injuries. With osteoarthritis, the dog may start experiencing joint pain and lameness, and over time potential loss of joint movement, of strength, and ability to perform several activities. Some become unwilling to exercise or even to walk. Signs do get worse over time and are intermittent at first and later become constant. Once a dog is diagnosed with osteoarthritis, it is important to understand that the focus is management rather than cure. Success means maximizing your dog's comfort and function while minimizing pain. The management of osteoarthritis relies on three key aspects: weight optimization, pain management, and activity modification. Initially, we should focus on weight reduction if the body condition score is greater than a 5, because this measure alone can delay the worsening of the osteoarthritis by several years and also decrease the existing clinical signs of osteoarthritis. A weight loss prescription diet is needed, and besides the impact on weight reduction, the food should be also a supplier of nutrients to reduce inflammation and pain, slow the degradation progress, and complement prescribed medications. Studies show that food supplemented with omega-3 fatty acids helped reduce the clinical signs of osteoarthritis, and for that reason, a food for osteoarthritis should contain omega-3 fatty acids. Glucosamine and chondroitin are also two common joint supplement ingredients that are used in both human and dogs. These supplements work by reducing inflammation, promoting healing, and increasing water retention in the cartilage, which provides more cushioning for the joint. Pain management is key to controlling the signs of osteoarthritis. Pain medications, particularly NSAIDs as carprofen and meloxicam, are the most effective form of pain management. Other painkillers as amantadine, gabapentin, or tramadol may be used in addition to NSAIDs if the pain is significant, or also instead of them if there are risks for the animal or the side effects are unmanageable. Be sure to monitor potential side effects as vomiting and diarrhea, for example, and discuss them with your vet. The activity of dogs with osteoarthritis should be adapted to their needs. Exercise is important to keep dogs fit and strong, but exhausting activities that trigger lameness and flare-ups should be avoided. Discuss with your vet if, in addition to drugs, nutrition, and supplements, physical therapy should be something to explore with your dog. Physical rehabilitation, acupuncture, laser therapy, and swimming are becoming more available these days and can be very helpful in extending both the quality and quantity of the pet's life. There are also some changes and improvements you could make at your home that makes your dog's life much more comfortable and easy. So raise dog food and water bowls from the ground. Something as straightforward as providing raised food and water dishes can relieve low back pain and make meal times more enjoyable. Dishes placed at the height between your dog's elbow and shoulder level are generally most convenient. Avoid outdoor living. Keep your dog with osteoarthritis warm and dry. Outdoor living is in general not appropriate for these dogs. Change to an orthopedic or memory foam bed to make sleeping surfaces more comfortable. Avoid stairs, jumps to enter and leave the car, jumps to the couch and bed as a way of reducing the impact on the joints. avoid slippery floors. Many dogs with osteoarthritis struggle just to get around their house in tile, hardwood, and other flooring. We can help them. We can help them out by having rugs to the floor, using gates to prevent access to rooms with slick floors, or in some dogs, consider making them wearing boots that give them traction on slippery surfaces. Also, to increase traction, keep your dog nails short. At last, surgical management can be indicated and in some cases is the best treatment choice. In severe cases, it is recommended surgery to remove damaged tissue from the joint or even to replace the joint entirely. So that's it for today, guys. If you have any questions, please leave a comment below.